Hello everyone, my name is Yongxin. My presentation topic for week 6 is caring. So before we get started, I want to share a quote that I really like. It's from Mother Teresa. She said, "Not all of us can do great things, but we can do small things with great love." So what this quote means to me is in nursing, caring isn't always about big life-saving procedures. It is also about the small everyday actions. Some examples can be listening to a patient, helping them to communicate, or making sure they feel safe and understood. Even if they seem insignificant, it could have a profound and meaningful impact on others when performed with genuine love. So the learning objectives for my presentation is first, define the concept of caring in nursing. Recognize the impact of caring. Apply caring principles in various contexts, including patient care, family, self-care, and community health. Identify common challenges that interfere with caring behaviors in nursing practices. Strengthen caring in personal practice and healthcare settings. So this is a general definition for caring in nursing. Caring is the human mode of being. It is both spiritual and human consciousness that connects and transforms everything in the universe. Action and competencies that aim toward the good and welfare of others. Special way of being, knowing, and doing with the goal of protection, enhancement, and preservation of human dignity. So caring in a professional nursing perspectives definitions, I gather 3 quotes from a professional's perspectives. So the first one is, nursing is viewed as a caring practice whose science is guided by moral art and ethics of care and responsibilities. This is from Banner and Rumbel. The second one is, humans are to be valued, cared for, respected, nurtured, understood, and assisted. And a nurturing way of relating to a value other toward whom one feels a personal sense of commitment and responsibility. So the impact of caring based on patient outcomes. I think caring can improve recovery and healing rates because a patient who feels genuinely cared often recover faster because their physical and emotional needs are acknowledged and addressed. One example could be a post-surgical patient who receives compassionate monitoring, pain management, and reassurance may experience less stress, which supports healing. It can also increase adherence to treatment and care plans. Patients are more likely to follow medications, lifestyle changes, or therapy recommendations when they trust the nurse and feel supported. For example, a diabetic patient adheres to insulin schedules better when the nurse takes time to explain, listen, and encourage. Care can also reduce complications at hospital. Caring behaviors like patient education, monitoring for early warning signs, and active listening help prevent errors and complications. So when a nurse notices a subtle changes in a patient vitals, they could intervene. If they intervene early, It could prevent risk of infection. Caring can also enhance patient satisfaction and experience. A patient report higher satisfaction when nurses show empathy, presence, and attentiveness. It can also promote emotional well-being and reduce anxiety. Providing emotional support is crucial in reducing fear, stress, and feelings of isolation. For example, a cancer patient feels more secure and supported when the nurse listens and acknowledges their fears. Caring can also encourage trust and open communication. Caring fosters an environment where patient feels comfortable sharing symptoms, concerns, or personal information. A patient may report early symptoms of infection, pain, or depression because they feel safe with the nurse. Caring can support holistic care. Caring addresses not just physical needs, but also emotional, social, and spiritual needs. Offering resources for family, supporter, prayer, or counseling enhances overall well-being. Impact of caring on nurse-patient relationships. It could build trust and rapport between nurse and patient. When a nurse shows genuine concern, empathy, and respect, a patient is more likely to trust them and more willing to follow instruction when they feel the nurse understands and cares about them. It enhances communication and collaboration. Caring behaviors like active listening and attentive responses improve information sharing between the nurse and the patient. Explaining procedures in simple language and checking understanding can ensure patients feel informed and involved. It can encourage patients to share concerns openly. Patients who feel cared for more are more likely to disclose symptoms, fears, or questions they might otherwise withhold. A patient may report pain early or share mental health concerns because they feel safe and respected. It reduces misunderstandings and conflicts. An effective, caring communication helps prevent errors or misinterpretations that could compromise care. Clarifying cultural or personal preferences avoids conflicts over treatment choices. It supports patient engagement in their own care. Patients feel empowered when nurses demonstrate caring and actively involve them in decisions. A patient participates in setting goals for rehabilitation when they feel their input matters. It improves overall quality of care and satisfaction. Strong nurse-patient relationships positively affect patient satisfaction scores and perceived quality of care. Patients who feel heard and respected from the nurse are more likely to recommend the facility or return to a follow-up care. It fosters long-term therapeutic relationships. In ongoing care settings, such as chronic illness engagement, caring behaviors strengthen long-term trust. For example, a patient with COPD feels more comfortable discussing symptoms over multiple visits due to a rapport built with the nurse. Impact of caring on professional identity. Caring can enhance job satisfaction and professional fulfillment. Nurses who participate caring behaviors experience a deeper sense of satisfaction because they're fulfilling the core purpose of their profession. A nurse who takes extra time to comfort a patient feels the intrinsic reward of making a meaningful difference. It promotes ethical practice and moral confidence. Caring reinforces adherence to professional values and by nursing code of ethics. By prioritizing patient-centered care, nurses gain confidence in making decisions aligned with ethical principles. It reduces burnout and compassion fatigue. When nurses actively engage in caring, they create meaningful connections that can buffer stress and prevent emotional exhaustion. A mindful presence with patient, even in small interaction, can restore a sense of purpose and reduce feelings of being overwhelmed. It strengthens professional and self-esteem and pride. Practicing caring behaviors builds a sense of competency and pride in one's role. Successfully advocating for a patient or seeing improved outcomes reinforces professional self-worth. Encourages lifelong learning and reflection. Caring can promote self-reflection and actions, decisions, and interactions, which promotes continuous growth and improvement. Reflecting on patient feedback motivates nurses to refine communication or clinical skills. It builds reputation on reliability and trustworthiness. The colleagues, patients, and families recognize and value nurses who consistently demonstrate caring behaviors. A nurse known for attentiveness and empathy is trusted to handle complex or sensitive patient situations. Applying caring principles on personal caring. Stress management. A nurse can be physically and emotionally demanding. Managing stress is crucial to maintain caring behaviors. Techniques to manage stress include mindfulness, meditation, journaling, or guided relaxation. So, in order to manage stress, we could possibly take a 5 minutes between patient rounds to practice deep breathing in order to release and reduce stress and improve focus so we could take care of the patient better. Healthy boundaries to avoid burnout. We could set a clear limits that helps prevent emotional exhaustion and burnout. So knowing when to step back from patient-family conflicts while still advocating effectively. Maintaining work-life balance. Balancing professional responsibilities with personal life ensures long-term sustainability in nursing. We could schedule regular time with families or hobbies to recharge and maintain emotional resilience. Physical well-being is also a way we could help. We could provide ourselves with proper nutrition, hydration, exercise, and adequate sleep. This could help to reserve energy and to help us focus and also with mood regulation. Skipping meals or working long hours without rest can reduce care capacity, and by doing so, patients might feel ignored because we are not giving our full attention on them. So it is important to make sure that we have adequate of rest and a proper nutrition and hydration. Emotional well-being. Nurses must attend to their emotional health by seeking support, processing experiences, and using coping strategies. Peer support groups or debriefing after critical events can help process these difficult emotions. Nurses should always seek for help if they feel stressed or overwhelmed by their task. They should always ask someone to, they can either talk to someone, ask for a more professional support, or maybe seeing a psychologist to relieve their stress. Mental health awareness and self-care practices. Recognizing early signs of stress, anxiety, or depressions and taking proactive steps to care for mental health is critical. Assessing counseling services or employee assistance programs when feeling overwhelmed. So here is the Maslow hierarchy of needs that I think it's important for us to know because this is related to caring. So the first level is physiological needs, which include food, water, warmth, rest, and reproduction. On the second level is safety, which is money, resources, shelter, and security. The third level is social, which include family, friends, community, and relationships. And the fourth one is esteem, which includes self-confidence, respect, excellence, and accomplished. And the final stage is self-actualizations, which includes personal growth, potential achieving, and peak performances. This is important because these levels of human needs that we are trying to fulfill could actually motivate our behavior. So by following these, we could improve better in nursing and caring for patients. So applying caring principles on direct patient caring, active listening to pay full attention, reflect back on what the patient just said, and asking to clarify questions. A patient expresses fear before a procedure, a nurse can repeat and validate concerns to ensure understanding. Presence at the bedside to simply being there to demonstrate a support and reduces patient anxiety. We could either sit for a few minutes holding the patient's hand or quietly observing to respond promptly to the patient. We could show empathy in communication by acknowledging feelings and showing understanding. This could foster trust from the patient. For example, we could say something like, I understand this, or I understand this is frightening for you. Let's take a step by step together. These sentences can simply help to reduce the patient anxiety. We could also provide comfort and reassurance. A small act like explaining procedures, adjusting positioning, or offering water can enhance the patient experiences. We could advocate for patients, such as ensures the patient's preferences, questions, and concerns are communicated to the care team. So if the patient is not willing to take a medication or perform a certain procedure that the provider has prescribed, we could always communicate with the patient or with their family to try to seek out for a best option for them. It doesn't necessarily a patient has to follow the procedure we have for them. It is more important for a patient to express their feelings, and we have to always respect the patient's choices. We need to observe subtle changes, so a early recognition of pain, distress, or deteriorations can demonstrate caring and improve outcomes. So it is important for us to assess the patient all the time. We need to make sure that we assess their reaction to drugs, for example, or maybe while we are taking their assessment, we could um, evaluate based on their face changes, if they have any um, signs showing they are appearing restless, angry, fear, anxiety. They're either frowning their forehead, grimacing, something like that. We could always, this is something subtle changes that we could recognize and in order to demonstrate care and improve outcomes and to prevent complications. Apply caring principles with family caring. We could include families in our caring decisions, so involve family members to ensure patients' wishes are respected and could improve adherence. So we could discuss treatment options with both the patient and family in order to enhance understanding. And communicating through families could also help the patient to adhere to the treatment. We could teach the caregivers skills, so families may manage medications, assist with mobility, or monitor symptoms at home. So example is when administering a insulin for a patient, we could demonstrate how to administer the insulin shot to the patient, such as teaching them how to inject it under their abdomen for a subcutaneous shot. This could improve adherence because they know how to do it, and and if it's an easy way to do it, they could adhere in it. We could teach care. We could address emotional needs. Families often experience stress, fear, and uncertainty, so we could provide support to help them in order to create an overall care environment. So we could offer counseling referrals or just simply listen to their concerns can help as well. We could provide resources or referrals, give information about home health services, support groups, or financial assistance is also something we could do for patients. We could encourage family involvement to engage the families to foster collaboration and promote patient recovery. We could also recognize families as partners, so we treat the families with respect, involve them in our planning, and value their input. So in community care, something we could do is a health promotion and education. So we could teach the communities about healthy lifestyle, hygiene, and nutrition. So for example, we could provide nutrition workshops for family and community centers Disease prevention and screenings is something we also can do for the community. And early detection reduces complications and healthcare costs. So we could teach the community about how to do a blood pressure test screening at home. We could use a blood pressure device to monitor our blood pressure, our pulse rate, and respiration rate, and others to help detect early symptoms. Also, we could encourage the community to do diabetes or cholesterol screening because the early screening can always prevent disease. Vaccine programs is also a good one. We could prevent outbreaks by doing so and protects vulnerable populations. For example, giving flu shots clinics is something that we always do offer at school or our local community centers to prevent the spread of influenza. We could address social determinants of health, identifying barriers like food insecurity, housing instability, and access to healthcare. We could connect families through food banks or transportation services for appointments. So many families, if they do not have transportation to go to a certain clinics or certain places for physical exam, they might just not go because they do not have transportation. But with transportation services, they're more willing to go because either it's free for them or it's more convenient because they don't have to figure ways out to get there. We could also have community advocacy and outreach, promoting policies and programs that improve community and well-being. So we could advocate something like smoke-free zones or improve public transportation access to clinics. We could also collaborate with local organizations, partner with NGOs programs, schools, or faith-based organizations to maximize the impact. So we could coordinate with health fairs or with local nonprofit for a wider outreach. So some common challenges on ethical problems are more distress, which occurs when a nurse knows the right to do something but cannot do it because due to policies, resources, or hierarchy, even though they know the right thing to do, but they just couldn't do it. Some example is they want to spend time with the patient, but they're just being forced to prioritize other tasks. So they wanted to speak to the patient, talk to the patient because the patient is asking or either expressing their concerns to the nurse, but the nurse just have too many tasks to do and or they have so many other patients waiting for them, so they just can't do it. They just can't listen to them for now. Ethical dilemmas such as a situation where values conflict. Example is an end-of-life care decisions. Patient refused for treatment. It is something that something that we should be aware of because even though we know that we have to save the patient, but if the patient says if the patient refuses to for treatment, then it is our thing to respect the patient's decisions. We have to know and understand the patient's decision and respect them. Balancing patient autonomy and safety, which is something I just mentioned. So we have to respect the patient. We have to caring requires respecting the patient choices when ensuring a safe care. Common challenges related to communication gaps. So a big thing is the language barriers. Patients unable to communicate may feel frustrated or misunderstood. So an example that we could do is to either use a professional interpreters to bridge the gap, asking for others to that a who is a fluent in this in a patient language to interpret for the patient. Low health literacy among patients. So patient may not understand medication instruction or care plans. So the nurse has to simplify the language and use simple words to help the patient understand. And the nurse can also use visual aids to help the patient too. Interprofessional miscommunication is something also can bridge the gap. We could clarify the orders and handoffs to prevent errors. Cultural differences, such as the difference in beliefs, may affect the treatment acceptance. So being cultural competence and cultural sensitive is something that we have to do as a nurse when we're caring for the patient. Patient education challenges, such as ensuring patients understand the instruction and follow up, is crucial for the outcomes. So some challenges on personal stressors. So a heavy workload and long shifts will, such as a high patient ratios, can limit the time for attentive care. So if a patient is coming up to you and trying to express their concerns, and since you have so many tasks to do, you will have a very limited time for that patient. So you might miss the patient needs, you might miss the time to hear their concerns. A family or personal responsibilities to balance the work and personal life may reduce emotional energy for patients. So if you, as a nurse, you have so many things going on with your life that you have to deal with, you might not be able to focus on the patient that much because it takes up all your emotional energy. So you might not be able to listen to the patients and showing empathy. Financial pressures. So a concerns about pay or job security can also distract from focus on care. Emotional exhaustions or burnout. Persistent stress reduces empathy and patience. Mental health challenges. Anxiety or depression can interfere with ability to connect with patients. So always seek for help when you need it. Always have counseling support when you need it as a nurse. Some common challenges related to environmental distractions. For example, digital distractions on phones, computers, alerts, constant alerts and multitasking can divide attention from patients. So, for example, if you hear an alarm ringing and because you are dealing with a lot of things, you might not paying attention to it, you might not hear it from it, so you might miss because the patient is calling you and you're just dealing with too many tasks, so you might miss that. So this is one of the distractions that as a nurse we have to be very alert to our surroundings, so to prevent any distractions. And noise in crowded units and loud environments can reduce focus and hinder meaningful interactions. Interpretation from patients or families, while well-intentioned, frequent interruptions can delay or fragment care. Time pressures, task overload limits time for bedside presence and attentive listening. Physical layout of units. Poor design can make it harder to respond promptly to patient needs. Nursing theories that could strengthen the caring through evidence-based practice. So a few nursing theories that I use was the Watson's theory of human caring and Swanson theory of caring, which is located at slide 5. We could also use evidence-based impact, which the research shows patient care for with compassion report lower stress, better pain management, and quicker recovery. We could also use guiding interventions, such as nurses can use evidence-based tools like mindfulness or communication techniques to improve health. To continue a ongoing learning is also important because we have to stay updated to ensure we are to strengthening our care in line with the best practices because things always changes. So staying updated, continues with professional development and education is crucial as a nurse. So we have, as a open communication is also important in caring. We have to be transparency because it could build trust. Patient value honesty about care plans and outcomes. Active listening is also important because listen to carefully can prevent misunderstanding and promote safety. So we could reduce errors. Encouraging questions. So patients and families should feel safe to ask questions about medication, procedures, or discharge. And we should always answer their questions patiently and use simple words. Interprofessional handoffs, a clear communication between nurses, doctors, and therapists to prevent gaps in care. Respectful dialogue. Inclusive communication ensures all voices are heard and reduce bias. So a patient-centered care involves a holistic approach. So caring is more than just physical needs, but also emotional, social, spiritual. And on the right side is the 6 human dimensions that I want to also mention with this. So the 6 human dimensions affecting health refers to the different aspects of a person's life and that influence their overall well-being. Health is not only about the physical body, but also the mental, emotional, social, spiritual, and environmental and intellectual factors that shape how a person feels and functions. So some examples from these dimensions are for physical dimension, um, um, to maintain a good exercise, adequate nutrition, um, adequate sleep can promote and healthier. We also have to look for our emotional and mental, such as to prevent stress, have a good coping skills, and develop our self-esteem. So for the social dimensions, a good relationships, families, support systems can help as well. For spiritual dimensions, values, beliefs, sense of purposes, and for environmental dimensions such as living conditions, access to healthcare, and safety is also something that we have to include in caring. So promote equality and inclusivity. So caring requires awareness of cultural, racial, gender, and socio-economical differences. So being able to have that cultural competence and cultural sensitive to patient. We have to understand different patients have different culture, so they might have different beliefs, different thoughts on things. So as a nurse, we have to communicate with the patients. We have to respect their beliefs. If they refuse on something, we have to respect it. We have to understand that this is the patient's things and we cannot force them to do something that they do not want to. For safety and dignity, we have to ensure patients feel safe because it is a foundation of trust. Patient empowerment to involve patients in decisions increases adherence and satisfactions and respect the patient values. So a caring nurse adapts care to fit the patient's cultural and personal values. So strengthening caring practices. So we could use evidence-based practices to guide caring interventions, open communications to foster trust and safety, holistic, inclusive, patient-centered care to ensure dignity, safety, and equality to remain priorities, encouragement and patients' involvement to better outcomes, to have a better outcomes. So caring is not just a soft skill, but it is central to patient safety, healing, and professional nursing identity. So when we combine evidence-based practice, open communication, holistic care, inclusivity, and empowerment, we strengthen our ability to provide truly compassionate care. Nurses are uniquely positioned to stand in the gap for patients, families, and communities by ensuring dignity, respect, and healing in every interaction. So this is an article that I found. It's about caring behaviors of nurses. So I know it's quite long, and I want to just summarize it into a few points that is important. So from this 2021 cross-sectional study, what the result is 70.6% of nurses show positive caring behaviors, whereas 29.4% shows negative behavior. And nurses focus more on duty-driven care than intrinsic motivation. So as I mentioned earlier, if a nurse has plenty of workload, they have to deal with different patients because they have so many tasks to do. They cannot just put their time on one patient because since they have so many tasks following that, they cannot just listen to a patient for like 30 minutes of that. So that's why they care because they're more a duty driven instead of intrinsic motivations. So higher caring for a third ages over 30 years or experience over 59 months or PPE training shows a higher caring possibilities, and with lower caring possibilities, married nurses, staff nurses, or temporary trainee nurses show a lower caring probabilities. So this study actually shows that caring is essential, but under pressures in crisis, as a nurse, we still need training, support, and motivation in order to improve. So caring is not just the optional, but it defines nursing. So while a challenge exceeds the evidence shows that caring improves outcomes, building trust, and strengthening our professional identity. In order to sustain caring, we need education, support, and deliberate practices. So here's the quote from the study as well. So caring is the core of nursing, but it needs support, training, and reinforcement to be sustained under stress. That's why we always need further education, updated education, and professional growth as a nurse. This is how we could improve our care to patient. So this comes to the end of my presentation. So some key takeaways that I want to give is always remember caring equals the core of nursing. Some impacts for caring can be patient outcomes, nurse-patient relationships, professional identity. Caring applies in multiple contexts: self, patients, families, communities, challenges, ethical dilemmas, communication barriers, stressors, distraction. Strengthening care by evidence-based practice, open communication, holistic inclusive care, patient engagement, which research show caring is essential, but requires training, support, and recognition. So here is some NCLEX style practice questions, and I will be giving the answers at after my presentation. I'll be posting answers along with my discussion, so you guys can find the answers and explanation along with my presentation when I submit it in the discussion section. So this is some question that you guys can answer. And here's the references of my presentation. And thank you for listening to my presentation, and thank you everyone.